Hi guys, and welcome back to Navigating the Periphery. My name is Deborah, still never changes, and this is my son Philip.
Hello!
How is everyone doing today? If you're into what we're doing on this channel, you guys know what to do. We want to try and get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis, one show at a time. If you know anyone who could benefit from watching this channel, please help spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone. We're here.
We are. So Philip, how are you doing today?
I'm doing great today, Mom. How are you doing today?
I am good and excited to discuss today's topic, but first, I would like to give a bit of a disclaimer here. We are not medical professionals or doctors.
No, we are not. Our channel is for informational and educational purposes only, and I'm speaking to you guys out there from my personal life experience with the OCD, GAD, and schizoaffective disorder bipolar type.
Yes, please refer to our full disclaimer at the end of this and every episode that we put out. So Philip, take it away.
Today, we are going to navigate the periphery of having to change psychiatrists when you have a complex mental illness like schizoaffective disorder bipolar type. This can be a very stressful circumstance, as I was apprehensive at first, but I was having some issues that upset me and were not being addressed. In previous episodes, I've talked about medication side effects. The specific ones that bother me are excessive sweating, increased appetite, and my body movements, whether it's dystonia or tardive dyskinesia. As we discussed in episode 27, Why So Twitchy, we will link that episode in the description box below.
Now, up to this point, Philip has been with his psychiatrist since he was diagnosed in September 2020. It was during the COVID pandemic, and it is in a hospital near where we live. At that point in time, Philip was apprehensive about everything. We were fortunate this psychiatrist was referred to us by someone I know in the practice that I currently work for. It takes time to establish rapport and confidence between a patient and a psychiatrist, particularly for those with complex mental health diseases. The therapeutic relationship is foundational for effective treatment, and starting over with a new psychiatrist can feel daunting, unsettling, and cause anxiety.
Yes, it can cause serious anxiety. Trust me. Patients who suffer with a complex mental illness, like myself, often have a detailed and intricate psychiatric history. Communicating this history to a new psychiatrist can be overwhelming and time-consuming. The fear that important details might be overlooked or misunderstood can add to the stress. Your treatment plan should be tailored to your unique needs and circumstances, with clear and measurable goals that guide your progress if you're not experiencing any positive changes. It's essential to discuss this with your psychiatrist and explore alternative treatment options. Remember that making a change doesn't mean you failed, but rather it's a necessary step towards achieving your mental health goals.
Wow, you actually breathed there. That was good.
Thank you.
Now, this is all well and good for the average patient, but Philip already has issues with expressing what and how he is feeling. Compounded with the anxiety of having to do so is a pretty anxiety-riddled scenario. Effective communication is at the heart of any therapeutic relationship. If you find that your psychiatrist doesn't listen actively or doesn't take the time to explain their approach to treatment, it may be challenging to build trust and achieve positive outcomes. A great psychiatrist should be skilled at active listening, be able to ask the right questions, and express themselves clearly and concisely. If you feel like your concerns aren't being heard or you don't understand the treatment plan, it may be time to consider a change. Remember, effective two-way communication is crucial for building trust and rapport, which is essential for a successful therapeutic experience. If you're struggling to communicate with your psychiatrist, it may be helpful to write down your concerns and questions beforehand and bring these notes to your appointment.
So I did just that. The excessive sweating, increased appetite, and my body movements, and he kind of blew me off. It was a 10-minute appointment, and when I left and I felt dismissed, my mom asked me if he addressed my issues, and I told her no. Needless to say, she wasn't happy. I know she wants me to advocate for myself, and I did just that, but nothing came of it. So at my next appointment several weeks later, I brought it up again, and he lowered my Abilify by 5 milligrams. But only at my insistence. I kind of felt like I wasn't being heard. I was growing more irritated over the situation. Now, another big issue I have as of late is his practice is now owned by the conglomerate that runs the hospital. I used to be able to reach him if I had an issue or questions. Now, when we call, we get the runaround. We leave messages, leave portal messages, and hear nothing back. I'm sure many of you can relate, especially in a post-pandemic world.
Now, being in the medical field, I know how these types of places operate. And I have no issue being so persistent that it's annoying until I am heard. Sadly, it's the way that many physician offices operate now. But when Philip ran out of one of his medications, I really lost it. He's always on top of how much medication he has left and also how many refills he has left. So for me to have to call for 3 weeks straight every day to refill a prescription is unacceptable, especially with antipsychotic medication.
Yes, my mom is a lovely woman, but can be vicious, especially when it involves me or protecting me. And now she was furious.
Yes, to make a patient who is already experiencing complex mental health issues jump through hoops to obtain their medication is not acceptable in any circumstance. However, I wanted it to be up to Philip to change his psychiatrist because it's truly his choice, because he needs to be comfortable.
So I asked my clinical psychologist for a referral to a different psychiatrist, and she provided me the information I needed. And then the stress began. So, this new psychiatrist was female, and her office was standalone, meaning she is not affiliated with either of the hospitals near my house, so her practice is solely devoted to her private patients. So, it's different in that she is not in charge of a whole psychiatric ward in a hospital.
If you have specific concerns about the treatment plan your psychiatrist has recommended, don't hesitate to raise them. You have the right to understand your treatment plan fully and feel comfortable with the approach your psychiatrist is taking. If you feel like your concerns are not being addressed, it may be time to consider a change. It's essential to remember that you're an active participant in your treatment plan and have a say in your course of care. If you're uncomfortable with a particular medication or therapy, or if you feel like it's not helping, it's crucial to discuss this with your psychiatrist and explore alternative options. My voice is cracking here, I apologize. There is no one-size-fits-all treatment plan, and what works for one person may not work for another. Don't be afraid to ask questions and seek a second opinion if necessary, which is exactly what Philip decided to do.
Adapting to a new psychiatrist's style, methods, and personality requires an adjustment period. During this time, the patient might feel uncertain or skeptical about the new treatment plan, which can exacerbate symptoms of anxiety or depression. So, knowing this, the day of my appointment, I had a lot of anxiety, but I pressed on. It was an extensive and detailed 2-hour intake with 2 of her residents who work under her. And then they presented all the information to her with my mom and I in the room. And I have to say, coming from a research background, I was really impressed. I genuinely liked the residents and liked my new psychiatrist. She asked why I was considering leaving my current psychiatrist, and I explained why. And to my surprise, she addressed my concerns, and we are going to work on trying to change my meds to minimize the side effects I'm concerned about. Slowly and over time. Now, I'll be honest. I feel a little guilty about canceling my upcoming appointment with him after being with him for almost 5 years. But I need to do what is best for me, and I felt good about my decision in the end, and the most important thing is, I felt heard.
I am proud that you came to your own decision, and I applaud you for doing it on your own.
Thank you.
There are many things a new patient can feel anxiety about when seeking a new therapist or psychiatrist. Patients may fear being judged or misunderstood by a new psychiatrist, especially if they have had negative experiences in the past. This fear can prevent them from being open and honest about their symptoms and struggles. Then there's also navigating insurance, policies, coverage, and the administrative aspects of transferring care. That can be stressful and time-consuming, adding an extra layer of stress to an already challenging situation. Fortunately, Philip's new doctor is on our insurance plan, so that's good. A psychiatrist often plays a central role in a patient's support system regarding their care. Sometimes this can feel like losing a critical part of that support, leading to feelings of vulnerability and uncertainty. Changing psychiatrists can be challenging, but it's essential to prioritize your mental health needs.
If you're experiencing any of the things we discussed in today's episode that you personally feel are not being addressed regarding your care, it may be time to explore other options. Remember that finding the right psychiatrist is a journey, and it's reasonable to try different professionals until you find the right fit. Thank you for tuning in today, and please remember, it's okay not to feel or be okay all the time. You are not alone. We're here.
That was very dramatic.
Thank you.
Thank you so much for joining us for today's episode of Navigating the Periphery, where here we are trying to stop the stigma of a mental health diagnosis one show at a time.
So until we see you again in our next episode, please take care.
Yes, take care. We will see you in our next episode coming really, really soon. Have a great evening. Bye for now.
Bye.